Thanks very much, Molly. At most aerosol meetings, I'd be coming to talk about soot, but this has been a strange year, and probably like many of you, people in the healthcare field have been coming to ask aerosol questions. And Fraser Health Authority in British Columbia operates a lot of the hospitals, and they've been having some COVID-19 outbreaks, some of which they attributed possibly to airborne transmission within multi-patient hospital rooms. And they were in the process of buying hundreds and hundreds of air purifiers to put in these rooms, and we're curious about how they should use them in the rooms. And I'm conscious of this being probably the last talk or the last two talks coming before you and a beer, and I just say listen to the last two talks before you get in a restaurant or bar, unless you've been vaccinated. A lot has been established about air purifiers. It's very clear that if you run air through a filter, you're going to remove the aerosols that would be containing the COVID causing virus. And experiments in open rooms show that things are pretty well mixed if you're talking about the smaller aerosol modes. But there's still a lot that was not so established. It's still not really clear whether in practice there's been a demonstrated reduction in transmission thanks to air purifiers. The interactions of the air purifiers with ventilation systems is not so clear, especially also the interactions with things like curtains and screens. And one of the concerns we had initially was that you might use the air purifiers in a way that would blow larger droplets across the room, increasing the risk of transmission rather than decreasing it. You've probably all seen diagrams like this. The blue and the green curves here show the volume distribution of aerosols and droplets produced by humans coughing and speaking against aerodynamic diameter. And there's clearly a lot more mass in the larger droplet mode, but in the 1 to 10 micron mode, you may have particles that are enriched in the virus, and so it may be that that mode is what's concerning for the transmission. And it's important to note that the settling time in a room for particles of just under 10 microns would be about 10 minutes. And that's a settling time which will interact with the ventilation systems of most rooms and also the kinds of interventions that we might put in like air purifiers. And you can see that with a very simple box model, a well-mixed room. And just as a framework for the experiments I'll show you in a minute, what I've got here is the concentration that you'd expect by adding purifiers that are processing a certain quantity of air, that ratio with respect to the concentration without purifiers. And so we want a low number here. And the bottom axis is the air purifier air change per hour, which I would define as the clean air delivery rate of the purifier divided by the room volume. If you're looking at 30 micron droplets, whether the air change per room per hour of the baseline room is 6 or 3, you get a modest reduction by the addition of air purifiers. And that's simply because the large droplets are going to settle out long before they're removed by a filter or by the room ventilation system. But as you go down to 3 microns with a poorly ventilated room, then you can start to have a substantial impact from the air purifier that you might add to the room. So this is context that we're considering this, and this assumes a well-mixed room, which we also want to look at more carefully in our experiments. And what I'll show you are some simple experiments that we did, and then some even simpler modeling used to interpret the results, all motivated towards understanding how we might reduce the transmission from one patient to another in a multi-patient room. So we used an aerosol tracer experiment and measured the aerosol concentrations with a low-cost PM sensor that binned the data according to 3 sizes. We ended up not binning the data. The results for the 3 bins were almost identical. So for the experiments we've done, it's practically the same as doing a gas tracer experiment. We had our simulated COVID patient, which was a simple ultrasonic mesh nebulizer. generating particles for 10 minutes. And the median size of the particles was something on the order of 2 microns. And it produced a very small jet, probably about 40 centimeters, not that far from what a patient might be doing. We looked at several kinds of air purifiers, either venting vertically or venting horizontally and in different configurations around the room. The room, you can see the dimensions here, about 6.5 meters square. Normally you would have 4 patients in the room, and we had no patients in the room. It was an empty room. We had the atomizer located on one of the beds, and then we would have up to 6 sensors located at different regions of the room. The dashed lines indicate places where you would have curtains drawn around the beds, and we looked at several curtain variations, including no curtains, the normal curtains, which had a gap of about 18 inches at the top and the bottom, and then the long curtains, which extended right to the floor. We looked at several air purifier configurations. Our favorite was having the air purifiers in the corners of the room venting upwards, but we also looked at what turned out to be the more conventional one for them, which was air purifiers venting horizontally, either directly towards the center of the room, which was their initial configuration, or directed towards the walls. Yes, so that's the layout. And here's a picture of, in this case, the air purifier venting up towards the corner of the room. Here's one of the ramp sensors in a poor facsimile of a patient inhaling aerosols. I'll take you through a typical experiment before we look at the data a little more carefully. In the plots that I'll show you, we've got the sensor color indicated to highlight the curves on the right. So for example, the atomizer shown with the red circle and the blue interior is next to the red sensor. And in this experiment, you'll see that has the highest concentrations and high fluctuations because it's so close to the sensor. One small eddy is going to bring high concentration air over to that sensor. We did this transient experiment because we wanted to look at the transport time across the room. It's something we wouldn't have gotten with a steady tracer release experiment. And one of the things we looked at was the time at which the sensor started reading above background concentration. So the atomizer was turned on at time 0, and you can see that in the zone by the atomizer, the concentrations start reading in about a minute, and the farthest away you get a delay time of about 5 minutes. And we believe that's significant because the settling time of some of those larger droplets is on the order of minutes. So if the transport time is on that order of magnitude, the transport time makes a difference. We extracted a few features from these traces. One was the decay rate, giving an effective air changes per hour for the aerosol based on whatever purifiers are added, and the baseline ventilation and settling. We also looked at this delay time and also a kind of benchmark simple concentration just at 15 minutes. The atomizer is on for 10 minutes. So at 15 minutes, we have an approximate way of comparing the concentrations and the distribution of concentrations after the source has been turned off. Okay, so that's a typical experiment, this case without any air purifiers and with the curtains. And here's coming at you a big mess of data for all the experiments, and I'll just take you through reading this very briefly. What we have here are the concentrations at 15 minutes for the different sensors. So if you read in a vertical line, This is one experiment. This is in particular experiment 1. And there are no purifiers in this case. And you can see the range of concentrations at 15 minutes for the sensor close to the source versus far from the source. And then we have generally decreasing trend of concentrations as you increase the clean air delivery rate of the purifiers. And there are some variations with the curtains as well. And I'd like to show you a few comparisons, which I think will make this a little clearer. So here are some otherwise similar experiments where we've done is we've gone from the long curtains, which go right to the floor, to normal curtains that they would normally put around the patient, to the no curtain case. And here we have the 4 air purifiers. And you can see what happens as the curtains are removed. You start to get a tightening up of the aerosol concentrations. Things are better mixed. You don't have quite as high a concentration in the zone by the aerosol source, but you do have a higher concentration away from the source, as you'd expect with better mixing. But there's still quite a lot of transport of aerosols across the room, even with this long curtains, and that's something to keep in mind. Another interesting comparison is looking at the case of the horizontal vented purifiers located between the beds. Now we had curtains up here, but when you have the air purifier directed towards the center of the room, we get essentially the same concentrations everywhere with a very short delay time in transporting the aerosols at just a couple of minutes, which would mean that you could transport larger droplets across the room. And just by changing the direction of the air purifier so that you're blowing the air at the wall and then diffusing that jet over the wall, you get a bigger spread of concentrations between the different zones. In a way, what we'd like to do, though, is not look at the transient results, but would like to understand what would happen to a patient that was injecting aerosols continuously over a long period of time, to look at the long-term exposure. And so we've tried to get at how to get at this. We've done some multi-zone modeling, which is basically 5 zones and fitting exchange coefficients to the transient data so that we could then use those exchange coefficients for the room that include things like the overall air exchange rate of the room, the ventilation supply. And then we can extrapolate that to consider the steady releases, or also the effect of particle size by introducing settling into the model. So on the right, I'll show you an example of how the multi-zone modeling matches we can make it match the data reasonably well. And then we can use those exchange coefficients to model the steady releases for different particle sizes. And so coming up to the second to last slide here, what I want to do is compare the concentrations at the different zones, steady state concentrations. What I've shown here to start with is the baseline case with no air purifiers, with short curtains, using that model that's been fitted to the data. And now I can see what would happen if I had 3 micron particles, or if all of them are 10, or all of them are 30. And as you get to the 30 micron particles, the concentrations would be greatly reduced at steady state because of the settling. As you go around the room, the concentrations are reduced. And even for the 3 micron particles, which are essentially not settling out at all, there is a reduction in concentration as you go further away, just because of dilution and transport out of the room. If you add air purifiers, you get a much reduced concentration, and that reduced concentration is more substantial for the 3 micron particles than it is for the 30 micron particles, consistent with what I indicated earlier. If you're looking at the 30 micron particles, for example, there's essentially no effect from adding the air purifier. And that's basically baked into the model calculations. I'll just finish up with a few conclusions. One of the things that surprised me a little bit about the experiments was that the transport time across the room is only 2 to 4 minutes for all of the cases we looked at. And when you consider that the residence time in the room is 10 to 15 minutes, you do get a pretty good mixing of the aerosols, and you do get transport of the 30 micron particles across the room, despite our recommendations of physical distancing. We had highly variable air changes per hour in the room due to air infiltration and exfiltration. There's probably a confounder in the experiment, but also a realistic thing. And another interesting thing about this was the curtains, even very extensive curtains, produced very modest reduction in transport across the room, which you might want to think about the next time you go to a restaurant with plexiglass barriers between the booths. So with that, I'd like to thank you for your attention, and if there's time for questions, I'll take a few.
Yes, thank you very much, Steve. Great to hear the work that you've been doing. There's one question, at least in the Slido. If anyone else has any questions, feel free to move on over there and ask them. But Martin asks, nebulizer particles might be highly charged. Could this influence your results? If it filter efficiency losses to surfaces, etc.
That's a good question. We did not neutralize them. And that probably is part of it. In terms of the filtration by the air purifier, I don't think it's an important effect, because all of the air filters are already highly efficient for these particles. But in terms of the room losses, it could be a factor, indeed.
And he also had a comment here that the plexiglass barriers actually increase transmission because they hinder ventilation. So onto the good point.